All of the Houston area cases involve people in their 60s or 70s, and the early data shows older adults and people with underlying health issues seem to be the most at risk. From new precautions and nursing homes to a change in how seniors get medical health, Melissa Correa breaks down the facts.
Take it from this 72-year-old.
Don't panic.
Instead, practice good hygiene.
Wash your hands. Don't sneeze on nobody. Don't be around anybody sneezing and coughing.
David Adams shares the lessons he learned yesterday when Sugar Land's health director talked to seniors about the growing concern over the coronavirus.
It may be a little bit more dangerous than what we've had in the past, but I think everything's being done to protect us.
President Trump just signed off on $8.3 billion. It will help communities fight the virus, and it expands telehealth services for Medicare recipients, so older folks can talk to a doctor by phone without leaving their homes. Medicare will also cover testing for coronavirus, and Medicare inspectors are now focusing on nursing homes. Earlier this week, the Texas Department of Health and Human Services alerted long-term care facilities to practice infection control and prevention. It's what nursing homes normally do during a flu outbreak: screen staff and visitors, scrub down surfaces, isolate and monitor patients who show symptoms, and be more mindful of how patients are moved between a nursing home and hospital. For people like David, who live alone,
Told us we probably should avoid large crowds.
So what does he think about that?
It doesn't bother me a bit.
He'll proceed with caution.
Yeah, I'm going to the casino anyway.
Senior centers will too. Extra hand sanitizer is available to help David make it through another health alert.
Swine flu, bird flu, Ebola, and stuff I can't remember. I'm too old to remember all that stuff.
But at least he's here.
Yeah, I'm still here.
Melissa Correa, KHOU 11 News.